Developing today, more than 24 states are going through some form of reopening this weekend, and among them is Texas, where retailers, restaurants, and other businesses are now open at 25% capacity. Joining me now is Texas Democratic Congresswoman Eddie Bernice Johnson, one of two nurses in Congress, for which I thank you. I want to say I'm awfully proud to have spoken with the other nurse in Congress, your colleague in Illinois, Lauren Underwood. So you ladies are the epitome of devotion, that's for sure. But as we look to Dallas County, your district falls within Dallas County. It reported a record number of new coronavirus cases as the businesses began reopening yesterday. Is your district ready to reopen?
I do have some questions, and I really do hope that people will use common sense. I'm very, very interested in listening to the medical professionals to see whether or not we're really ready. I realize that the businesses are suffering. People miss going out, but this is an unusual time, and we've had to face that more person contact spreads this virus. We've never dealt with this for most of the people now that are born, but we need to make sure that we are certain that we are protecting ourselves and others. We just last week started to ask everyone to wear a mask going out. There was some pushback in that. We're typical Texans that don't necessarily want someone to tell us how to act. But this is a critical time, and I go along with restricting as long as we can. I realize there are we have probably more small businesses than many states. And they're suffering, and I understand that, and I really do sympathize with that. But we must look to save lives first. And so I'm a little concerned about opening this quickly.
And do your constituents share that concern? I'm sure you are accurately reflecting the fact that they're frustrated, they want to get back out there. But do they want to do it now? Do they want to do it yet? And if they don't, what do they still need to have before starting to go out and patronize your businesses?
Well, I would simply say to people, caution. There's still a lot of pickup. I know people are tired of being at home. There are ways in which you can make that up. I know that I'm vulnerable, and I've been at home and working from home a lot longer hours than I work otherwise. But it is very important to emphasize that not only do you protect yourself, you protect others as well.
May I also, ma'am, I'm sorry for interrupting, wearing your hat as a nurse, when you see the kind of protests that were countrywide yesterday for those nurses who are saying, please just give us what we need to be protected. How much longer are we going to have to hear their cries? Is there anything Congress can do to ensure that they are safe on the front lines?
Well, Congress has tried. It's a matter of trying to get the materials. In this area, what we like most is testing. We've got to do very much more testing. I've helped our county to get more body covers and masks. We were really caught off guard. I think all over the country, but certainly here. And I still am not sure if we're getting enough materials. I have joined my colleagues in pleading with FEMA, pleading with Health and Human Services to get more equipment and to be ready to do more testing. I think testing is the key. I think research to find a remedy is ultimately needed. There's no point in thinking that we can pay for the damage of this virus. We have got to attack the virus itself. And we certainly need to protect those frontline nurses and caregivers.
Indeed, we do.
I have some concern about that.
I should think you do. As a former nurse and currently as a Texas Democratic Congresswoman, Eddie Bernice Johnson, thank you so much. Do stay safe. Appreciate your time.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.